Thanks very much. I'm used to bringing the mic down after Nick is on there. If the next speakers can come up, and while they're talking, let me just provide some context. Creating the standard, it's a big can of worms. Can you imagine? You know, and what constitutes a neighborhood? Social care just took up a big chunk of discussion, of thinking. We had data as being a critical consideration. For me, one of the primary pillars in designing the standard was mobility, because without mobility, you can't have independence. So it is fundamental. And when planning this event, we were looking at how we address each subject. And I'll be honest, I hadn't cracked mobility. So I was scratching my head walking back from the meeting in Woolwich with our friends from Greenwich Council, and I walked past something called the Smart Mobility Living Lab. And I walked past, and I walked back. I said, what is a Smart Mobility Living Lab? And it had some electric vehicles. It looked like a car showroom. Big. And I knocked on the door, and it was closed because it was earlier in the morning. So while I'm knocking, somebody comes to go in the door. So I stepped back, and I thought, well, if you're going in, what is a Smart Mobility Living Lab? And Paul says, it's a Smart Mobility Living Lab. I said, okay. And he's got his briefcase, he's got his coat. And I said, you know what it is? He said, yes. I said, well, the reason I'm asking is because, and I explained to him, and he said, that's interesting. So I said, you work here? He said, I'm the CEO. And lo and behold, we now have our session on mobility. So Paul will contextualize that. Paul has introduced me to Gordon McCulloch, who is the CEO of Research Institute for Disabled Consumers, and Fiona Jarvis, co-founder of the Blue Badge Style, who unfortunately is unwell today, but she was looking forward to participating in this discussion around mobility. It's a very big subject, so we're not going to cover a huge amount, but this is the challenge I threw down to Paul, which he was kind enough to accept.
Thank you very much, Ian. Morning, everybody. Right, well, we're two down, aren't we, when we're starting, because you've got two middle-aged white men, and we're in front of lunch. So, and by the way, we've got to deal with the whole of mobility. So I tell you, it's going to be a rocky 3 hours. I've got the easiest chair job, though, because I've just got Gordon, who is a rock star, as you will hear in a second. Let me just introduce myself a little bit more. Yes, I'm the CEO of TRL. TRL, some of you may have heard, is actually the privatised research organisation of the Department for Transport. It's 93 years old this year. It's now just a UK SME. We work worldwide. We produce software consultancy services, and we built and run the Smart Mobility Living Lab in the UK. I'm not going to talk a lot about that. Happy to outside if anyone's interested. But what does it do? Well, for example, Nissan have got 3 development locations for driverless cars globally. They've got Yokohama, they've got Silicon Valley, and they've got Woolwich. And why Woolwich? Well, because in Yokohama, no one's ever broken the law. In Silicon Valley, lots of autonomous vehicles, but the sun always shines, 6 lanes, everything joins at right angle, and it's illegal for people to cross the road. And in Woolwich, it's the Wild West. So that's where the cars really learn how to deal with the real world. Before I did that, by the way, I ran the Transport Systems Catapult, which is one of the 10 catapult centres which belong to Innovate UK, part of UKRI, whose job is to grow the UK economy by fostering innovation. Before that, coincidentally, I was with IBM for the very longest time. So I'm really a digital data, AI, transformation, change sort of person. But that comes in quite handy in transport. Gordon.
Thank you, Paul, and thank you, Ian, for the invitation today. I am not a rock star, so to manage some expectations. RIDC, Research Institute for Disabled Consumers, we've been around 60 years. We're a small research charity that came out of Which, back when Which was a small garage in Bethnal Green. Back then, they realised that they needed to look at the product, or the people who use the products, as much as the products themselves. And we formed as a little tiny research unit. And over time, they stumbled across the fact that disabled and older people were facing the most barriers and the most significant barriers to using anything, whether that's transport, getting into shops, trying to buy stuff by mail order, I guess, in the 60s. We then became a charity back in the early 90s because businesses came to us to say, can you help us make our products and services more accessible? And that's essentially what we do. It's as simple as that. We have a panel of over 4,000 disabled people, pan disability, so every type of impairment you can think of, spread right across the UK. And increasingly, our emphasis has changed because the problems that disabled people face because of the barriers that are put in place by society, we sort of know what those are, and we'll talk more about what they are in transport. But increasingly, it's become more about finding the solutions to help transport planners, to help transport providers and government and policy, trying to embed lived experience right from the very beginning. It's a sort of wonderful job we have at RIDC because we'll never finish. The world will never be 100% accessible for everyone. And I think the concepts that we were talking about today in terms of smart neighbourhoods or neighbourhoods that are designed for intergenerational living, I think a lot can be learnt from the work that we've done at RIDC, but also how you base what a community needs and wants by speaking to the actual people who use those things. So my background has been working in community development and community assets. I spent a long time in Southwark and in Lewisham and Waltham Forest working with the local authorities on trying to get the voice of communities heard and embedded into their work and how they design systems. So this has been a fascinating morning for me, actually, just listening to what the standards are trying to achieve. But I think this session, mobility, is, Ian, you said it in the introduction, it's critical. It's fundamental to independence. It's fundamental to people feeling connected to where they live and to have a full and independent life. And there have been many bold statements made this morning, and I'll make another one. It's not my words, it's the chair of the Select Transport Committee last year that said, accessible transport in the UK is a national embarrassment. And I think that there is a lot to be done to consider the 16 million people, at least in the UK, whose lives are limited, who can't spontaneously go somewhere because the transport systems and travel haven't considered or listened to their needs. And we bandy around big numbers. I think just to put it in perspective, that 16 million is the combined population of Scotland, Wales, and all of Ireland. So I have to reunite Ireland to get even close to that 16 million. So it's a large population. We think we know what the problems are. I think we know what the solutions are, but there's an awful lot to be done. And I think, Paul, you at TRL, certainly on the system-wide, you've got a very good view of where the challenges are and where things fall.
Well, good. I mean, you've made a set of really important points there, and I think we probably both strongly agree, and we want to convince you that transport is in danger of being complacently taken for granted in some of this discussion. And let's put some more numbers around that. So 16 million, 20% of the population at any given time is disabled in some way by the transport system from fully participating in the social, economic, political life of the country. Why at any given time? Because we all move in and out of disability, don't we? Disability is something that's done to us by the provision of the systems. It's not something that's intrinsic to us. And we're all born unable to take a bus, and at some point during our lives, people will go in and out of the ability to use the transport system fully, and unfortunately, many of us will end our lives struggling to retain connection with the provision that we've got. And if we want to be really hard-headed about it, that 20% of the population which is prohibited in some way from fully participating in the life of the nation, on average they take about 38 fewer trips a year. The Motability Foundation 3 or 4 years ago did a work that sized that at about £72 billion worth of economic impact. £72 billion. I'll be honest with you, that's more than I earn. and that number, which is a massive opportunity cost, it doesn't represent, as it were, the human potential, does it? But it ought to be a motivator to do something about this. And I'm frustrated, I think, Gordon, you're the same, that transport, as I say, it can be the result of complacency. The transport is not named in the industrial strategy, for example, of this country, which means that the UKRI doesn't prioritise its spending on transport innovation. And yet, the productivity in the transport infrastructure system hasn't moved over 40 years. So all the arguments about potholes are in the background of an industry that has not improved its productivity in 40 years. Transport systems that we all use are based on a set of technologies that are, in many cases, 19th century technologies. Let me suggest a couple of technologies to you you'll be quite familiar with. Bus stops and timetables. A wonderful piece of technology to coincide in time and space with your transport when no one knows where anything is. But actually, for the whole of the 21st century, everything, the first order approximation, has been digitised at all times. And yet, we're not innovating in this space to provide better outcomes for people.
I was just going to pick up on that point of innovation, that I think you look when the C5 was introduced to now, the leap forward in technology in terms of personal transport has been incredible. So electric cars is perhaps one of the most significant changes that we have seen in terms of transport. But there have been things like shared micromobility, scooters and stuff like that, and now connected autonomous vehicles. All have emerged as new technologies. All have habitually ignored the needs and views of disabled people in their design, in that rush to implementing and put in place the new technology. We were the first people to look at the inaccessibility of public charging points for electric vehicles, for wheelchair users, anybody with a dexterity impairment or anybody with a vision impairment who was being driven by somebody else. It's taken a long time for that to even be recognised, and now there's a PAS 1889 that has something like 32 different standards that a charge provider would have to put in place. We just finished work in London looking at the number of accessible public charging points there are, and it was 0.3% of them actually met the standards. So a new technology like that, disabled people like everybody else want to play their part in the environment and make a difference, but actually there's a fundamental barrier there because a very simple thing didn't happen. Whoever designed them didn't think that actually disabled people drive cars, and therefore designed it without thinking about disabled people. Shared micromobility in the smart neighbourhood actually would be it's an answer to a question that would allow people to have quick, accessible local transport. Again, legislation stops scooters and other electric bikes being made accessible, and so we're being held back by legislation. Connected autonomous vehicles as well, I think, will be key in your standards for the smart neighbourhoods. But again, the design and the lived experience of people who would transform their lives just has never been considered at the beginning. And I think that's where we, and I particularly see, legislation is holding things back. We're still running off the 1988 Invalid Carriages Act, which is a horrible term for an act, but actually hasn't kept up with technology. And I think that's one of the big barriers we see a lot, that legislation and the sort of influence and input of disabled people just aren't helping make transport more accessible in the UK.
Well, that's absolutely right, Gordon, and you and your organisation have done huge work to try and defray that, but there's a lot more to do. A couple more observations, but then I want to throw it to questions, partly because I want to remind you that we're still talking and you can't go to lunch. So, transport mobility is fundamentally a systems problem. Nowadays we talk about triple access planning because it's not just about the individual's ability to get somewhere, it's about their proximity, their accessibility for things to come to the individual. And of course, digital connectivity is not an optional thing either. So we have to think about how our systems provide those triple access possibilities. The other thing is that there's an infinity of innovation in the transport space. The shelves are groaning with gizmos. What there isn't is a lot of adoption of innovation. And it was very interesting listening to the last session, not just the last session, but talking about the cultural barriers to innovation and the way that the measurement systems, actually the way they culturally conceptualize this stuff, can be the real barrier to innovation. Because it drives the economics, it drives the priorities, it therefore drives the boundaries of the systems that we look at. And that's always true in transport, which is an incredibly complicated stack of different technologies and systems, has got breadth across the whole of our lives. So these are fascinating problems. As you can probably tell, we both feel passionately about the impact that these can have, and we're both extremely excited to hear about the new standard. And we think that there's a lot the transport industry, the mobility sector can contribute to this. I think we need to work more closely together. But you may disagree. What are your questions?
On the standard, when we talk about mobility, we're also talking about in the actual community in that regard. And could you just comment on how innovation in terms of personal vehicles, for example, for people who become frail, at the moment they're disabled vehicles and they basically are not, in my opinion, totally dissimilar to the old button which says I am disabled. Mm-hmm. But in reality, as people become frail, they need devices. What's your views in terms of how that's going to evolve?
Shall I start?
Sure.
So thank you, Ian. What can we do about personal mobility? Well, the good news is that we have many more technological degrees of freedom than we ever used to have. So the Motability Scheme, of course, is famously the way that we provide individuals, one of the ways we provide individuals with personal mobility. But let's extend the time back a bit. How do you help people to avoid becoming frail or become frail later? Well, the answer is you help them to have more active, more healthy lifestyles, and a device like an e-bike, the research shows, extremely good way of helping people to be mobile and in a much more active way. You may think, oh, no, they'd be better off walking or cycling. Yeah. But if they're not going to do that, an e-bike is a really good way to get people out of the house. So that's a new technology which, mark my words, is going to have a lot more impact than driverless taxis. So there's also a whole new set of formats. So it depends totally on the regulatory regime, but in some European countries there are very small electric vehicles that can be driven without a driving licence. So 14-year-olds can drive them. Works in a city, works in some context, clearly safety implications. But I mention it just to say there's a whole different set of possibilities that we can have if we choose to do it. I'm vehemently against the idea that regulation is red tape and that it slows innovation. Actually, regulation is necessary for innovation because regulation creates markets. And the perfect example is e-scooters, which, as you probably all know, I'm sure you do, are perfectly legal to buy, but they're illegal to use on the road and on the pavement. So anyone you see who is not on a hire scheme e-scooter is breaking the law. And because of that, no reputable manufacturer is going to enter that market. So all of those scooters have come in from Temu or something from China. They are unregulated. They burst into flames. They are not safe. They don't respect the speed limit, etc., etc., etc. There is no market because we haven't created a market through regulation. By refusing to regulate, we have removed a profit opportunity for local manufacturers. Sorry, I went off on one there. Gordon.
All I would add is, in response to your question, Ian, the answer is mobility scooter. They are medicalised, they have a stigma, and the way to get rid of that is, one, around regulation. There's a type 2, type 3 type of mobility scooter that can or cannot go on the pavement, is design something that actually doesn't speak or look like it's something about disability or impairment. It's something that anybody would want to get on. That's the perfect example of a design that is not seen as a medical thing. A pair of glasses is, everybody wears them, everybody gets different types, but you don't think of it as an assistive aid, and it is. And so you made the point earlier on about universal design, thinking about transport within the neighbourhood that anybody would use. It's not stigmatised, it's not seen as a thing that only disabled people use. It's something that everybody would like to use, and it's a bit aspirational, is the way around that. But it's a mixture of design and regulation, and really considering the environment that the people will be moving around, and design that for a future where people will acquire disability, even if they don't say that they're disabled as they get older, and make it something that's accessible from the very beginning, but desirable.
Absolutely right. Any hands while we're waiting for hands to go? I'm going to take that one. What about 15-minute cities? Well, 15-minute cities is a smart neighbourhood. It's a smart neighbourhood. Let's not forget, though, that everything you wear, that you consume, that you use is the result of a global supply chain. And so transport is at least as much about stuff getting to you as you getting to stuff. So 15-minute cities are not self-sufficient. And we need to be really careful when we think about a smart neighbourhood that we don't have a pocket of excellence, right? But we don't think about other places where actually provision is going to be harder. Because a 15-minute city is difficult. A perfect example. It's very easy to conceptualise, very attractive, quite difficult to do, isn't it? Because the economics drive us into centralisation and low density, because of the regulatory environment we're in. Right? But a 15-minute city, absolutely fantastic if you're in the centre of London or Leeds, wherever, Cambridge, where I live. These are fantastic, easy places to live. If you live in Aberdeenshire, if you live in bits of Pembrokeshire, if you live in Northumberland, then you ain't getting a 15-minute city because the density is just too low. And we have to think about those environments as well, because economics drives many of the disadvantaged into those environments precisely because they're less attractive to live. And so the house prices are lower, and so you get this reinforcing cycle, don't you, of exclusion.
I'm just thinking when we were talking about LTNs, low traffic neighbourhoods, within an LTN, it works, the different things are put in place, and traffic's slowed, and the outcomes are achieved. I'm just thinking about the boundary roads that sit outside of that and what they are like and the impact of that. And it's on your point, it may be accessible and may work within one of the neighbourhoods, but what's it like around the outside? And how do people integrate with a fragmented transport system outside of the neighbourhood as well, so that they can have a full and independent life? It's one of those sort of unintended consequences in the push-pull of doing something in one place, and what are the trade-offs in another.
Yeah. So, Ian, are we going to lunch, or do you want to take us, because there was a question at the back?
Yeah, one last question. Yeah, thanks.
Hi, I'm Navas Davudian from University College London. I don't have a question, more of a point of view. When we talk about accessibility and transport for older people, accessibility basically starts from people's doorstep, because that's where they start walking to bus stop to train station. And if this route is not accessible, whatever we do on our transport system doesn't work. My specialty is light and lighting, especially street lighting. So I'm more interested in after dark environment. And when I'm talking about after dark, I'm talking about 4 o'clock, 5 o'clock in the afternoon during winter time. And at the moment, street lighting standards is based on young adults' visual needs. For residential area, we have 5 lux standard for on horizontal surfaces, which for older people, basically, to experience the same to have the same experience as younger people, they would need 15 lux or 20 lux. But if we talk about this to our local council, they would run away. We can't increase the light that much. It's energy cost, environmental cost, and so on. So now when I'm thinking about, using smart technology in our environment, I think that would be the best use or one of the best use of a smart technology. To instead of having a universal higher light level everywhere, to think about how we can manage this situation and have the same accessibility for everybody. Because at the moment, our street lighting is letting down our older people, and we all know that in very soon 1/3 of the population are above the age of 65. So we need to think about that as well. Thank you.
And the answer is yes. Let me apologise for being flippant, but there's a whole set of things wrapped up in that. We've talked about a few of them. Let me just mention one. We have traditionally valued the public realm incorrectly, and the perfect answer is parking. Right, so curbside access it sounds like the dullest, most technical, most regulatory thing, but it's really fundamental to some of these things, because the curbside has traditionally been valued at £0, with the exception of some parking. And we've got a culture of entitlement around the curbside. And by the way, we've got a culture of complacency and arrogance actually around it when it comes to curbside kissing, which is dropping off or picking up on the curbside, delivery vehicles, parking on the pavement. There's a whole set of contesting needs that we've got on what is frankly a public asset, and we need a different discussion socially about that public asset, because you talk about the journey starting from the front door. Right, well, unless we're talking about the minority of people in this country who've got off-site parking and their own car, 20% of people in this country don't have access to any car at all, by the way, and very many don't have access to private, then everyone's going to be using the public asset, which is the curbside. We've got to get realistic about how we share this stuff out and what the economics and the regulation are around that. Gordon, is there anything you want to add?
Other than if Fiona was here, she would be talking about blue badge parking and how challenging and how contested that has become as well. But no.
Okay. Thank you very much.
Thank you very much, both of you. Excellent. So before we break for lunch, and we'll return at 1:45, can I ask anybody who is allergic to any food to meet Anthony, who's waving his hand at the back, and he will take you to the right part of the buffet. If you are thinking of social media, I would encourage you to do so, LinkedIn, whatever. And we did have a hashtag, so we'll put that back up so you can use that if you like. And without further ado, I'd like to wish you a bon appetit and thank all of our speakers this morning, and look forward to getting back into it later on. Thank you very much.